In HealthWatch, nearly one-third of Wisconsin residents live in rural areas, but current statistics show only 13% of physicians in our state actually practice there.
Local 5's Connie Feldman shows us how Aurora Baycare Medical Center in Green Bay is helping to train young physicians who are interested in filling those gaps in small-town health care.
Recent med school graduates will be heading into Wisconsin's rural communities to practice primary care specialties, thanks to a partnership between Aurora Baycare Medical Center, UW School of Medicine, and Public Health's Wisconsin Academy of Rural Medicine, or WARM. Those new doctors will help play a vital role in our state's healthcare system.
A possible infection, and we admitted her to the hospital because of that concern.
Fourth-year medical student Clayton Skogman is learning to practice medicine with invaluable hands-on training right alongside an experienced physician at Aurora Baycare Medical Center.
They are seeing patients right alongside the physician. They are doing surgery with the surgeons. You know, sometimes they are a first assistant. They're actually standing across from the surgeon, you know, helping out with the surgeries. So it's a lot of hands-on experience.
I don't think any acute events overnight.
Skogman is part of the WARM program, Wisconsin Academy of Rural Medicine, a partnership created to help fill the healthcare gaps in our state's more rural areas.
Around 30% of the Wisconsin population lives in rural areas, and I think as of now, only 13% or so physicians practice in rural areas in Wisconsin. So there's a bit of a disparity there.
Dr. Trevor Cooper is still getting used to that title, just days after graduating from medical school.
I'm going to have to get used to that.
While being called doctor may be a novel experience for Cooper, his duties as an obstetrician will be nothing new.
I've delivered, I think, over 30 babies by now, which is something that not all medical students get to do.
But unlike all medical students, Cooper went through the WARM program, as did the new Dr. Mack, a small-town girl herself from Merrimack, Wisconsin. Mack says her background gives her both an understanding of the challenges facing rural health care.
Lots of barriers to access to health care for rural patients. Less physicians live in rural communities, and there can be issues like lack of transportation to get to clinics or hospitals.
As well as an appreciation for the benefits of a more low-key lifestyle.
I've loved living in a rural community for most of my life, and see myself as someone who would do well going back to a rural community and be able to provide access for patients.
Which Dr. Medich says is the whole idea behind this collaboration, now in existence for more than a decade.
The whole purpose is to choose students that have a high propensity of graduating from medical school, finishing residency, and then coming back to practice in rural Wisconsin.
91% of graduates from the WARM program go on to practice medicine in Wisconsin. To learn more, visit aurorabaycare.com or use their LiveWell app. You can always just give them a call, too. And that's your Health Watch. I'm Connie Feldman, Local 5 News.